our time. So welcome to Diabetes, the Sweet Truth, and we are so excited to have you here today. We know that there is a lot going on this week, and so the fact that you took time to, attend this presentation and learn more about your health is really a big commitment on your part, and we just commend you for taking time for that this week. So we will get started. My name is Abby Horton, and I am a registered nurse. I have a master's degree in nursing, and I'm also a certified health and life coach. And I know that it's exciting for us to be together today. Let me go ahead and start my video. Perfect. And so I'm also a Wellbeing ambassador for the Honors College and a wellness class educator. So you have my contact information here. It's Abby.Horton at ua.edu. And if you have any questions or anything that you'd like to reach out about after the session today, you're welcome to do so. So the impact of diabetes. In the United States alone, we know that 1 in 3 Americans is either diabetic or pre-diabetic, and so that costs us an average of $242 billion in medical treatments in the U.S. every year. And so the latest data that we have here is from 2015, which is pretty current. It's 9.4% of the population has diabetes in the U.S., and of the 30.3 million adults with diabetes, 23.1 million were diagnosed, with 7.2 million being undiagnosed. And so we know that there are people who are walking around, perhaps campus or Tuscaloosa today, who have diabetes, but really just haven't had the diagnosis yet. And so it's important that we create awareness, that we, are able to get resources to those individuals, and that we have, annual checkups and well-being screenings so that we're really on top of our numbers and we know what our health looks like. And so, again, 25.2% of Americans over age 65 have diabetes, whether it's diagnosed or undiagnosed. And then 1.5 million Americans are diagnosed with diabetes every year. So that's a new diagnosis for them. And then 84.1 million Americans over the age of 18 actually have prediabetes. And so we're going to talk about prediabetes just as a way to think about prevention. And we know that there are lifestyle changes and modifications that we can do to actually improve our health, whether we're pre-diabetic, whether we have a diabetes diagnosis, or whether we're simply just looking for ways to get healthy and improve our overall health and well-being. So diabetes is considered to be the 7th leading cause of death in the U.S., and we know that that is an important number that we need to change. And so we're going to talk about the impact of diabetes in Alabama. So for more than 15% of adults in Alabama, they have diabetes, and it's estimated that 37% of adults in Alabama actually have prediabetes. And so I included this chart, this kind of map here of what the diabetes prevalence looked like in 2013. And it actually has worsened over the last 5 to 7 years, but it is difficult for this surveillance system to update this information on a continual basis, because there's so many factors that play a role in how diabetes numbers are tracked. But I did want you to see that, of course, here in the Southeast, we do have a higher prevalence of diabetes, and we have a higher prevalence of obesity, which goes hand in hand. And part of it is our lifestyle choices. Part of it is that we like to eat sugar and we like to eat fried foods, and we have sometimes a more sedentary lifestyle than others in the country. We have lots of great outdoors to enjoy, but we often do not do that as much as our counterparts out in the Western states. So we know that we have some work to do with lifestyle choices, not only our movement and our diet, but other things that we can do to improve our health. And so for those of you, I'm sure you know diabetes and what it is, but we'll just go over some of the basics. So diabetes is defined as having an increased sugar count circulating in the blood, and that can be known as hyperglycemia. And so hyperglycemia or high blood sugar is going to be something that we want to monitor. So if you go for a well-BAMA screening, you're going to have your finger actually stuck and have a little bit of a blood sample that's given. And you can do this with a fasting or non-fasting. So either you ate or you didn't eat that morning. And those numbers are going to change based on whether you had breakfast or whether you didn't. And so we have ranges of where your blood sugar should be so many hours after eating or so many hours after fasting. And so that blood glucose level is going to give you a good idea of how much that blood sugar is elevated in your blood. And then there's a test that you can actually have done at, your annual physical exam, and it's called a glycolated hemoglobin, which is HbA1c. And so this level is actually still obtained the same way. You can actually have it in a blood draw as well. So if you get, vials of blood drawn, usually out of your, kind of the bend or the crease of your elbow, you can get that blood sample as well. And that can give you a longer term measurement of your blood sugar over a period of usually 90 to 120 days. And so over the course of a few months, and this is the gold standard for diagnosing diabetes because it shows you what your habits have been like over the last few months versus whether or not you had maybe a donut or two or three the day before, and you just happen to have an elevated blood sugar still from, having to process that sugar and all of those, chemicals and additives and things that can be in processed foods. And so we know the gold standard is really the HbA1c, but we like to do the regular blood sugar check because that's a good screening tool. And so that in combination with the other things that we look at, we can give it a good idea or a good estimate of whether or not you need some additional resources. And so the risk factors for type 2 diabetes, we know obesity is an issue in the Southeast for lots of reasons, but particularly in Alabama. So obesity puts us at a higher risk because having excess adipose tissue, or what we call fat tissue, in your body is going to alter the way that your blood sugar is processed and utilized. And then we know that if you're over 45 years old, you also are at an increased risk. And that's due to some, general aging, but it's also due to the way that your body changes in response to the aging process. And then, of course, the family history is also a risk factor, a history of high blood pressure for yourself, or high cholesterol, or gestational diabetes, or just being physically inactive or sedentary, having a history of heart disease or stroke. This could be for you or your family members, a history of depression, and then a history of polycystic ovarian syndrome. And so there are others that we could list here, but these are the major ones that I want to call your attention to today. And so for the normal blood sugar levels, when we're looking at a person, without diabetes, we want theirs to be under 100 when we're fasting, okay? And that's what you see on your charts for well-BAMA. And then if you do have a diagnosis of diabetes, we're moving that range to actually accommodate the fact that we know you're going to have higher blood sugars. And so it's actually going to be the 80 to 130, okay? And then you have it listed here 2 hours after meals. And then you have the HbA1c, and that's the same thing as the HbA1c. It's going to be a percentage. And so a person who does not have diabetes, you want their percentage to be 5.7 or less. And then for someone under, suspect that they have diabetes or they have the diagnosis of diabetes, they want it to be 7.0 or less. And so you can oftentimes see people who have a diabetes diagnosis as being, in that 9 to 10 or even 11% range. And so it can get pretty high. I've seen them at 13% for an HbA1c. And so it's just important that you understand what those numbers mean and that you account for if you've had meals, because that will definitely change and alter those numbers for you. So for prediabetes, and this is one that I'm really excited about, talking and creating awareness around, because in the prediabetes phase, we know that there are many things that you can do that will actually either halt or delay the onset of diabetes. And that's what we really want to do here. We want to make sure that you can have the healthiest life possible for your individual situation. And so There are some claims that diabetes can be reversed, and we have seen, people who are able to, reduce the amount of insulin that they're on or stop insulin altogether. We've seen people who have been medicated for diabetes, using things like metformin or glucophage or Janie Med or any of the medications that control high blood pressure, high blood sugar, actually be able to get off those medications. And so whether you count that as an actual reversal or not, we know that there are lots of improvements that can be made. But the thing that we would love to do is to prevent diabetes onset from the beginning. And so we know, again, that this 87 million Americans that are diagnosed with prediabetes each year are really feeling an effect on their entire health and well-being. And so we know that their elevated glucose levels may not be quite high enough to be diagnosed with diabetes mellitus type 2, which is the official name of diabetes and what you think of when you think about diabetes. There's also a type 1, and so we'll talk about that next. But long-term damage can really begin with prediabetes, and that's why it's so important that we're understanding our awareness, our risk factors, and our lifestyle choices that are, really creating a scenario where we might develop diabetes later. And then healthy lifestyle habits can be reversed or can reverse signs and symptoms in early stages. And so that's important to know as well. So diabetes 1 and diabetes 2, we typically think about diabetes 2, and this is going to be typically your non-insulin dependent diabetics, someone who has adult onset of diabetes and that, they have, become diabetic over a period of years after they've become adults, and that advanced diabetes we know can lead to insulin dependence. And so typically a person who has diabetes type 2, they are going to develop it as an adult. They are going to start taking medications by mouth, or what we call, oral medications. And then as that progresses, if they're not able to actually make lifestyle choices to, kind of halt or delay or reverse their diabetes diagnosis, they often do actually end up needing to take insulin because they're just not able to produce the amount of insulin needed for the amount of blood sugar that they have circulating. And so sometimes you'll think about only type 1 diabetics having an insulin need, but that's actually not the case, especially as we're having individuals who are living longer and longer with a diabetes diagnosis. At some point, there may be a need for additional medications. And so it's really important that you monitor, if you do have diabetes, your blood sugar levels and whether or not your medication or treatment is actually being effective for you, and you may need more support. And so your healthcare provider is someone that would be able to really steward you and educate you and help collaborate with you as the patient to make the best choices for you in terms of treatment. And then for diabetes type 1, we typically think about these folks being insulin dependent because they are not going to be able to produce insulin on their own, even with the help of oral medications. And we used to refer to this as juvenile diabetes, and we don't typically say that as much anymore because we know that this can have an autoimmune component. And so older children or young adults are developing what's considered to be type 1 diabetes because it is more of an autoimmune response versus something that's just inherent to childhood. It's just that it's very common to be diagnosed as a child, because if you do have that autoimmune reaction and you're not able to produce the insulin that you need, it's evident in childhood because it's going to affect their growth and their development and things like that. And so that's some important distinctions that you may not know about, but we're constantly, adding to the body of knowledge that we know about, how we care for people, how we care for chronic illnesses and things like that. And so there's always going to be updates as we learn more about the human body. And so type 1 versus type 2, so the person does not produce insulin, and insulin is needed to transport the sugar from the blood into the cells to be used for energy. And so that's why it's so important that we have insulin, is because they're going to be, the thing that takes the blood sugar where it needs to go to get used. And so if there's not enough insulin, then excess sugar is going to stay in that, circulation of the blood. And it's going to cause a lot of symptoms for you. It's going to cause your blood sugar or your blood glucose level to rise. And then it's also going to make it difficult for your body to do all of the other functions that are needed. And I saw someone raise their hand. Do you have a question? Go ahead. If you have a question, you're welcome to put it in the Q&A, or you can put it in the chat, or you're welcome to unmute if you have a question. Okay, just interrupt me if you do. And then type 2 diabetes, we know that the person does produce insulin, but it is often not enough insulin to actually take care of the excess blood sugar. And so cells may just simply be resistant to this insulin, or it may just be that they're overwhelmed. A lot of times, especially in prediabetes, the person is just overwhelmed with the amount of sugar that we're eating. And so it's not that the insulin or the pancreas is inadequate. It's really that what we're doing is causing a burden that our bodies can't work the way that they need to. And so cell walls become resistant to this insulin, and the insulin becomes unable to transport that sugar from the blood into the cells, and then those blood sugar levels rise. Okay, and so it's important to understand, it's in very simple terms, what's going on with the blood sugar. And so we know just from talking about that, some things that we can do to actually help with this, whether you're a type 1 or a type 2 diagnosed diabetic, is for you to be able to actually increase, the amount of nutrients that you're getting, the amount of water that you're consuming, because that's going to help get the blood sugar, kind of processed and where it needs to be. So there's very simple things like walking and just, really low level movement and exercise can actually really be a huge boost to helping your body combat this excess sugar. And then of course, as a first line defense, we need to just make sure that we're not taking in extra sugar while we're trying to actually heal and restore our bodies. And so that's something that we're going to continue to talk about. We're going to go ahead and talk about a couple of other types of diabetes. You may not be as familiar with them, but they're really important to discuss. And so gestational diabetes, this is something that was considered to be a temporary diabetes diagnosis. And so this is where you have an expectant mother who, is pregnant and may have a test that shows that she has extra, blood sugar on board, and she may be having difficulty getting her blood sugars under control. And this is typically done with a glucose tolerance test in pregnancy, usually around the end of the second trimester. And it develops again during gestation or pregnancy. And individuals who have gestational diabetes are often told that this will go away once they have delivered the baby, and they're put on a diet and exercise plan and monitored closely by their physician so that there's no complications to the mom or to the baby. And so again, most people think that and expect that the gestational diabetes is actually going to resolve after the delivery, and most of the time it does. But you do have a greater risk for developing type 2 diabetes and cardiovascular risk, whether that's, a heart event or any kind of cardiac or circulation issues. Those risks are greater. You also may have babies who are weighing a little bit more than the typical average weight, which is around 7 pounds. Around 7 to 7.7 is the average of a baby who's being born in that kind of, typical weight category. And so you may actually have 9 or 10 pound babies. And so that often does cause complications for the mom, just because having a larger baby is going to make that delivery to be a little bit more difficult for you. And that puts you at a higher risk for C-sections and things like that and other medical interventions. And so we want to make sure that we're really screening moms well for this and letting them know that even after delivery, they need to continue to monitor their blood sugar and follow up with their physicians to make sure that the health of them and their baby is on target and that they don't need other support or help. And likely they do, but we want to make sure that they're aware of what resources they need and what signs and symptoms to be on the lookout for. I also want to talk to you about metabolic syndrome. And so, metabolic syndrome is really even less commonly known about than prediabetes and gestational diabetes, which is a cluster of symptoms that and conditions that actually occur together. And it increases your risk for heart disease, for stroke, and for type 2 diabetes developing. And then you also have the added signs and symptoms of increased blood pressure, increased blood sugar. You might have excess body fat around your waist or your abdominal area. You might have an abnormal cholesterol or triglyceride levels or both. And you can have, a lot of other symptoms based on those symptoms developing. And so your risk factors for this are typically going to be that you're either considered overweight or obese, and that you have, an increase in your age, again, that midlife range to above. And then you can also have some genetic components in terms of, having genetic risk factors for developing cardiovascular disease or some of these other conditions that are going to play a role in this metabolic syndrome. And then, of course, already having diabetes or other diseases like having a fatty liver, which that could be due to alcohol use, or it could be, an idiopathic or unknown reason. And then also polycystic ovarian syndrome and even sleep apnea, which is really underdiagnosed right now. So many people are suffering with sleep apnea, which causes many other issues, especially cardiovascular and neurological. And so I always tell people that if you wake up more tired than when you went to bed, it may be time to talk to your doctor, and it may be time for a sleep study, because typically, even considering stress and even considering, things like the pandemic and just all of the things that you have going on in your life, after you've slept 7 or 8 hours a night, you should still wake up more rested than when you went to bed. And for a lot of us, that's not the case, and it could be sleep apnea. And if it isn't sleep apnea, it could be other things going on with you medically that you would need some support. So metabolic syndrome, I'm really visual, so I think this is a helpful graphic for you to look at to just understand what's going on. But you're going to have the high triglyceride levels, the low HDL cholesterol levels, which HDL, you can remember, is your healthy cholesterol levels. Those are actually, HDLs actually take the LDL back to the liver to be processed. And so you actually need a higher level, greater than 60 on an HDL score, to have enough of those, what you can consider Pac-Men, that kind of gobble up the bad cholesterol, or, the unhealthier version of cholesterol, because those are going to take it back to the liver to get reused, just like insulin is that Pac-Man that takes the sugar to the cell to get used. And so you need a good, healthy HDL level. And I don't like for us to talk about it in terms of good and bad, because it's all necessary and needed. Even the LDL is needed. Even blood sugar, of course, is needed for survival and for your body to function well. It's just when it becomes unbalanced where it becomes problematic. And so if you can kind of think about that instead of, the good versus the bad. A donut is not inherently bad. It's just that in combination with other lifestyle choices and, other factors, it may not be the best choice for you, but it isn't an inherently bad food. And so we'll talk more about that. We also have visceral obesity, and this is really talking about abdominal fat. And so if you carry your weight in your midsection or your upper body, like I do, I definitely do, then you're more at a risk for having things like high blood pressure, high cholesterol, obesity, overweight, diabetes, because that is going to be adipose tissue or fat tissue that actually is going to surround your organs. And that is going to be more harmful than if you carry your weight in your lower body where it isn't surrounding your important organs like your heart, your liver, your pancreas, your spleen, your stomach, and things like that. And so having your, adipose tissue be mostly distributed in your lower half, if you tend to gain in one way or the other, and you don't have an even distribution, is going to be, kind of challenging. You need to have it be either an even distribution, or it would be preferable not to have it be in your mid area, the core of your body, because then you're not going to have that extra adipose tissue surrounding those organs, which is going to make it difficult for those organs to function properly. So you also then, of course, have insulin resistance and hypertension. And so if you have all of these things in combination, this is considered to be a cluster. And so then that would be a cluster of conditions or symptoms, which is called metabolic syndrome. And many, many Americans have this without knowing that they're actually in a category of a condition called metabolic syndrome. And so again, if you have these individual diagnoses, then you do most likely meet the criteria for metabolic syndrome. And that just puts you at an increased risk because it's difficult to elevate your HDL sometimes. It's difficult to change your cholesterol numbers or your triglyceride numbers. It's difficult to get a handle on your insulin or your blood pressure or even your weight, your BMI. And so, and I say that as someone who has always struggled with their weight due to an autoimmune condition. So I understand the struggle. But when you have all of those things in combination, it really is even more difficult. And so that is why it increases your risk. It's not a compound effect in terms of, they make each other, more problematic as much as it just makes it more difficult for you as the person to, overcome all of those challenges. And then for the physician or provider to actually, make recommendations and be able to help with all of those things because everything in our body works together. And so it's just important that we're aware of that and not be concerned and frustrated with it, but just know that you will have some extra challenges and you might need some extra support. And so we're going to provide some resources for that today. So again, metabolic syndrome, we want to prevent it. We want to prevent, prediabetes and diabetes. We want to make sure that when we make healthy choices, that it really is a lifelong commitment to a healthy lifestyle and that we're not, using short-term fixes or, other diets and things, that are short-term solutions. And so we want to make sure that we're getting 30 minutes of physical activity a day, that we're eating plenty of fruits and vegetables and lean proteins and whole grains, that we're limiting the saturated fat in our diets and also our sodium or salt intake. We want to make sure that we're maintaining a healthy weight and that we're not smoking. That can really be difficult because when we have something like nicotine on board and some of the other substances that are in the tobacco and things that are smoked, that can actually be really difficult for your circulatory system. And so that again will increase your actual risk for heart disease and other cardiovascular issues. And so we want to be really particularly mindful of that. So early symptoms of diabetes are going to be things like increased thirst or increased hunger or frequent urination. And so you can also even have frequent urinary tract infections or UTIs. And so those are going to be the first symptoms that you see. And those are really generic symptoms, but when you put them together, if you have increased thirst, hunger, and urination all together, that's going to be a little bit more telling. And so it's important that you recognize those. And those are called the 3 Ps. And then you might also have dry mouth or unexplained weight loss or weight gain, depending. But typically you'll lose a little bit of weight at first, and so you might even get excited about that. You can have fatigue or blurred vision or headaches, and there's any number of other symptoms that you could experience, but these are the most common. And so again, it's the combination of the thirst, the hunger, and the frequent urination that's really telling. And so obviously it's very hot outside. It's August in Alabama and you're wearing a mask. And so you are going to be more, thirsty. Most likely you're going to have a dry mouth, probably more than you ever have experienced before, just from simply wearing the mask and not being able to drink as much fluids. And so really think about, your, blood sugar levels, your overall health. And then do you see that you have increased thirst and hunger and urination, even on days where you're at home and you're not having to be out in the heat or not having to wear a mask for a long time? And so those are some good early signs and symptoms to be aware of so that you can actually take further steps if you think that you need some additional screening or support. So some major diabetes complications and why it's so important that we, are aware of our risk factors and that we actually are controlling our diabetes condition is that you can have an increased risk for stroke and heart attack, like I mentioned, but also peripheral artery disease. You can have some diabetic retinopathy or neuropathy. You can have cataracts and glaucoma. You can have complications with your skin, particularly on your feet. You can have diabetic nephropathy, which is with your kidneys being impacted, and then that peripheral neuropathy, which is going to impact your feet and legs that almost can feel like a restless leg, pain syndrome that you can have. And so it's really important that we prevent the complications that you see here, obviously, so that you can have a good quality of life and enjoy your work and your family and not be burdened by these complications. And so I just want to encourage you that if you do have a diabetes diagnosis, whether it's new or whether it's pre-existing, that you stay encouraged that you can still make a lot of progress toward your health and well-being. That having the diagnosis does not mean that you're going to have a progression of the disease. It doesn't have to mean that. It doesn't have to mean that you have any of these complications. And certainly the more that you start to make the good, healthy lifestyle changes with the support and resources that you need, that you can actually live a really long and healthy, happy life that does not have to be, this, kind of scenario where you're having a lot of complications or progression of your disease that it actually impacts your daily living. So again, we've talked a lot about this, but just wanted to mention, the things that I listed on the previous slide. You're going to have an increased risk of these things with diabetes and some of the other risk factors like your higher cholesterol levels. And it's because over time, when that glucose actually continues to stay in the vessels without being taken to the cells to be utilized or processed, then it can cause damage to the lining of those blood vessels, and that can lead up to plaque build up in the arteries and can, further influence your cardiovascular health. And so that's why it's so important that you're getting your regular eye exams, that you're going to the, well-being screenings and your annual physical exam to make sure that you know your numbers and that you know your risk factors, and that you're getting your dental cleanings, because all of those things are going to give you good data about how your health is and what are some things that you can actually do to improve your health. And I always say to take it one thing at a time. And so make one healthy change at a time so that you don't get overwhelmed, because you could feel really overwhelmed by managing a diabetes diagnosis. For your neurological system, you want to make sure that, again, with all of the neuropathies and things that I mentioned, that is all about the excess blood sugar in your vessels actually causing some nerve damage. And typically this is not reversible, but certainly you can do things to prevent this complication, and you can also do things to actually make sure that the progression is not worse if you do have some neuropathy. And then the most common neuropathy that I mentioned is peripheral neuropathy, which is going to be that pain and that burning and tingling and numbness of the feet and lower legs. And so again, that can be confused with restless leg syndrome because some of the symptoms are shared. And so you want to make sure that if you do have signs and symptoms of diabetes, or you know that you have some of the issues that we've mentioned, that you track those symptoms and kind of keep an eye on them. You may need to reach out for some help, and there are some different therapies and different medication treatments that can help you if you do have these complications. We also know that your immune system can be impacted. When you have high blood sugar levels, you actually weaken the immune system response and its ability to defend you against the viruses and the different things that we come into to encounter in our daily lives, like infections and whatnot. So when we are in a weakened state, we can have things like foot infections, yeast infections, UTIs, or even surgical site infections. And so if you don't heal, in the expected time frame, if you have healing complications, you may have some extra blood sugar circulating and on board, and that may be actually weakening your immune system. Taking some supplements that are approved by your physician can really help with that. Things like zinc and vitamin C can be beneficial to your healing, and can also be beneficial in supporting your body to actually get rid of that excess blood sugar. And so I just want to make a note about this. When we think about the end of the October month, and we think about the holidays, and we think about having a lot of sugar and treats from October to the end of the year, even to the beginning of the new year, we kind of start with Halloween and some of the fall festivals and activities that we have, football and all of those things that happen in that October month. And we start to have less sunshine, less vitamin D exposure. We start to be around people more in closed areas. We're not getting the same level of fresh foods that we are during the summer months. And so we enter what could be considered a flu season, but we also could think about that really our lifestyle habits are changing at that point, and all of the things like less sun exposure, that less vitamin D that you're getting because of the sun exposure being limited, the fact that we're putting a lot of sugar on board because we're having a lot of parties and candies and treats and things, and we just are having colder weather, so maybe we're kind of weakening our immune system in that way. All of those things in combination can impact our overall health. And so I want you to think about how you can make some adjustments this season when we're getting to those colder months, where we can actually ward off some of the things that we really consider to be expected. And you might see a lot of improvement in your overall health, even if you're on this call and you don't have a diabetes diagnosis. Or most especially if you are on this call and you do have a diagnosis or a suspected diagnosis, that you can actually support yourself to actually feel well this season. And so, diabetes, the sweet truth. The sweet truth is that you do have the power to actually change your health and to change your lifestyle, to improve your overall health and well-being, to manage your diabetes well, and to make some really important decisions about your health, because you are the person who is empowered to make those choices for you. And I know that diabetes can be a really difficult disease to manage. My husband actually has diabetes, and so I firsthand understand, from seeing him, what that is like for him by being able to observe, and then of course from my nursing experience, but certainly living and seeing it every day, it can be really difficult. So again, I want to commend you for taking steps to either prevent or to improve your health around this topic of high blood sugar, because I do know it's hard. And so we're going to explore some more resources for you. So with prevention is really what you can do for treatment too, in terms of making sure that you're taking the right actions to be able to be healthy. And so we want to make sure that you're nourishing your body, and eating and nourishing your body are very different. So we're going to talk about how to eat for health and not for weight loss. And so you want to become more active. You want to make sure that you're moving your body intentionally every day. You want to make sure that you're getting plenty of rest and sleep. And so, sleep and rest can be sometimes used interchangeably, and I don't use them interchangeably because sleep is needed for the body for you to function, but rest is something to me entirely different. And so you're not designed to wake up in the morning to your alarm clock and then go all day long without a break and without resting until you go to sleep at night. So if you are doing that, then this might be one of the most important things that I share on this call. And it's something that I had to learn personally. If you're waking up at 6 o'clock or whenever that is for you by your alarm, and then you're going constantly, physically or mentally going constantly throughout your day without rest breaks, then you go to sleep at night and you're still working up until bedtime, and then you expect to just hop into bed and set your alarm for the next day, you might get 7 to 8 hours of sleep and still wake up tired the next day because you didn't rest throughout the day. And so if you don't, take time to rest, if you don't feel like you have time, I would really recommend that you start setting an alarm for mid-morning, mid-afternoon, and then mid-evening, and start incorporating, 5 or 10 or 15 minutes of rest throughout the day, either in the morning, afternoon, or evening, until you're regularly resting at least 5 to 15 minutes 2 to 3 times a day, because you want to give your body a break. And so this doesn't mean that you're sitting down to watch TV. This doesn't mean that you're scrolling on your phone or checking emails or something like that, because you're really not giving your body a rest or a break, because you're getting a lot of information on social media or through emails. And even if you're just kind of mindlessly scrolling, something that you enjoy, it's still, taxing your brain to process those images. Even if it's something like Pinterest or Instagram, or photos of your family, that's still taking some energy away from what you're trying to do, which is actually restore your body. And so whether you close your eyes, or whether you take a walk, or whether you just go and get a healthy snack, those are some ways that you can really disconnect, unplug from technology, and rest yourself, rest your eyes, rest your brain, and then get back to your work. And I think you'll see a big improvement in your energy levels. Of course, if you're on medications, you want to continue to take those as directed. You want to take care of your body. You want to avoid the use of tobacco products and smoking, like I mentioned, vapes and all of the substances that we know to be, harmful to us. And then we want to make sure that we're keeping routine medical appointments. And so if you are going to make some lifestyle changes and you have diabetes and you're on medication or you're on insulin, please, please, please reach out to your healthcare provider who is managing your diabetes before you actually start to make changes. Because if you're on medications, insulin, oral medications, and you make some of these healthy changes, you may actually bottom your blood sugar out by making these healthy changes. And so you don't want to do something extreme like, cutting out all carbs or cutting out all sugar, or starting to do high intensity interval training or something like that, or even, a combination of those things, because you're going to actually alter your blood sugar levels, because it is a very effective way to lessen your blood sugar, but then you're going to have too much medication on board for that. And so definitely anytime you are making lifestyle adjustments, you need to reach out to your healthcare provider who's managing your diabetes, so that they can monitor you safely and they can adjust your medication doses as needed. And so please make sure that you do that just for safety. You want to make sure that you're being really safe about making these lifestyle choices. And then, of course, managing your stress, which is so easy to say and so hard to do, especially in the context of a pandemic. And there's just lots of changes that are going on in our world right now. And so we'll talk more about stress management. So some healthy lifestyle changes that you can make, and these are represented here in these photos. So I'll go through the next few slides pretty quickly, but these are all the things that you know to do, but that you probably just need some reminding or encouragement to do. And so you want to make sure, again, that you're focusing on your health and your wellness, not weight loss and not diabetes, because that's going to be something that's sustainable. You want to make sure that you're managing your blood sugar, and that when you're actually making these healthy lifestyle changes, that it's not just about the blood sugar, it's not just about the scale, how much you weigh, but that you're actually thinking about your overall health and how you feel. How you look is great, that's important to us, but how you feel is even more important than how you look or what a scale says. And so make sure that you know how to manage that for yourself and manage your expectations. Make sure that you know how to handle your stress in a positive way. Sometimes we have negative coping mechanisms to handle stress. So we are coping with our stress, but it may be negative, or it may not be as positive as it could be. It might be getting a coffee on the way home, or a soft drink on the way home, or picking up donuts on the way, into work, or what have you. But make sure that your stress, that you're managing it with positive coping mechanisms and not the things that are going to be more unhealthy. And then, of course, exercising and daily movement. We want to work towards, an exercise program, but you need to start small. And that might be something like moving in your kitchen, dancing while you cook dinner, or it might be walking around the neighborhood with your dog or your child or your grandchild after dinner. Those are great things to start with. You don't have to join a gym. You don't have to do anything extreme to start having daily movement in your life. And walking is one of the best, lowest impact ways for you to actually start exercising. And it's what I always recommend to people who are starting a new journey with your health and wellness. You want to make sure that you're not dieting and that you're not using dieting foods, because when you use things that are low fat, low calorie, they often have a lot of extra chemicals and additives on board that are going to be difficult for you to process if you have diabetes. They're difficult for any of us to process. And so it's better to actually pick the full fat version of food, or the full version of, not a altered source of sugar, because your body doesn't recognize and process those things in the same way because they're human-made products. And so eat the real food, just focus on eating real food, and making sure that those are healthy choices, and that when you do have sugar and you do have fat, that you're being smart about those choices and making the healthiest choice for yourself. You want to make sure that you're monitoring your blood sugar regularly, and each physician who takes care of patients has a different recommendation. When you're newly diagnosed with diabetes, we usually say 6 times a day is how much you should monitor, and that's a lot. That can really actually alter your day. Having to stop and check your blood sugar 6 times, usually around meals and then in between meals. And once you've been stable with your medications or your lifestyle choices, you usually can drop back to a couple of times a day, or when you feel symptomatic. And so track your blood sugar based on what your healthcare provider has asked you to do. If you're concerned about your blood sugar and you want to track it, you actually can purchase your own supplies at a local pharmacy to be able to monitor your blood sugar even without a prescription. It's pretty economical to do that. I don't know that it's necessary, but if that's something that's important to you, that is an option for you. And then make sure that you're getting those regular checkups with your healthcare team. You're going to see the physician more often, or provider more often, if you do have a diagnosis. It may be something like every 3 months instead of every year. So make sure that you do what you're instructed to by your provider. And then if you need help with your mental well-being, make sure that you reach out. We have a lot of great resources here as employees of the university, and our mental health can really suffer when we have a chronic disease. And so it's important that we take care of our mind, body, and spirit, and not just our blood sugar. So if you need help and resources, please feel free to contact us, or use the resources online to be able to make those appointments and really invest in your mental well-being as well. And then customize your wellness plan to fit your goals. And again, try to make those goals be lifelong goals and not about a scale or a weight or a size, or even, kind of obsessively tracking your blood sugar numbers, because we know your blood sugar levels are going to fluctuate throughout the day, and that's a normal body process. And so just remember to control what you can control, and to make it be about health and wellness, and not about kind of this weight loss mentality that we can sometimes adopt. And then you may want to join a group or a community for added support, and this will give you some added accountability as well. And so that may be helpful for you. Some wellness basics, I always tell people to start with 5 to Thrive, which is really taking care of yourself first. So making sure that you're sleeping well, you're getting that 7 to 8 hours of sleep, that you, are in a cool, dark room that's, kind of noise and distraction free, TV free, that you're staying hydrated. So about half of your body weight in ounces is what you need to drink daily. And of course, too much water can be, harmful to us. So make sure that you're not overhydrating. Nourish your body, like we mentioned, move every day, and then try to do a meditation practice for 3 to 5 minutes. You can do this on your own, or using some apps that are free to download out of your, Apple Store, or, whatever device you use. You can get a lot of great apps to actually support your meditation practice. And this really helps give your body rest. That might be something that you could do when you take one of your, breaks that you're going to build into your new routine. And this is really a reset for your brain. So sleep is really great for the body, but meditation is really great for the mind and the brain. And then nutrition, I'm going to go through these quickly because this focuses on really the dietary considerations for diabetes. And if you have a diagnosis, I imagine that you've gotten this information before, but you want to make sure that you are eating more vegetables than anything. So plant-based foods, a plant-based diet, that they're non-starchy vegetables, and that you limit your grains and your starches, that you make sure you have a protein and a healthy carb at every meal. And that's a complex carbohydrate, not just a simple carbohydrate. That you have your serving of fruits and vegetables, that you're choosing healthy fats in small amounts, because our brain needs fat for us to function optimally. So healthy fats are needed, they're not bad. And then to complete your meal, you just want to make sure that you're not adding a lot of sugar in your drink, because so many of us actually drink our calories. And so if you're drinking more than one soft drink a day, you are adding a lot of sugar content to your diet, and that is going to be hard for your body to overcome. Even things like diet drinks can be harmful because some of the additives and chemicals and things, bodies don't recognize that, and so it treats it almost like sugar. So I know the solution for many years was to drink Diet Coke or something like that instead of a soft drink, but that isn't actually a good alternative if you can just go cold turkey, or if you can pare yourself down to just a couple a day and actually wean off and just drink water. That would be the best. Or unsweetened tea. If you like sweet tea, you may want to start doing half and half to start the process of getting off of all the extra sugar. And same thing with coffee. So a healthy plate is going to be colorful and it's going to be balanced. So you want to make sure that you're eating the rainbow. Each of the foods that are here, red, orange, yellow, green, purple, think about how often you eat all of these colors. So many times our food looks bland and beige. It's beige or brown, and if we want to be healthy, we might throw in something that's green, but how often do you actually eat the other colors of the rainbow? All of those different colors represent foods that give you different nutrients. And so if you're not getting the reds, the oranges, the yellows, the purples, you're not getting all of the nutrients through your food intake that you need. And again, emphasizing the use of a protein, a complex carb, and a healthy fat at every meal, that's going to actually help you keep your blood sugar regulated, having that combination of those three things at every meal. And then make sure that you're actually tracking your meals and your snacks with a food journal. And again, to emphasize, one healthy change at a time so that you don't get overwhelmed. Our brains really like to add. Our brains really don't like to subtract. And so if you can add in healthy things, that makes it easier for you to make healthy changes. And then eventually the subtraction of the unhealthy items in your diet are going to naturally go away, because you have added so much good stuff to your life and to your diet that you don't have room for the extra donuts and sugars and things. And so try to think about what you can add to your life or add to your plate versus what you're subtracting or what you feel like you may be losing. And that's a really healthy way to readjust your mindset about how to make these healthy changes over a lifetime that feel really good to you and feel sustainable to you. So again, protein, you want to make sure that about a fourth of your plate or your serving for your meal is a protein. And you all know what proteins are. There's plant-based proteins, of course, lean meats and fishes and seafoods and cheeses and eggs and things like that are going to be great for you. Things like hummus can be a great way. Instead of the pita, you might use vegetables like carrots or cucumbers. And so there's always a way to make something healthier. And so I would encourage you to start looking for those opportunities. For complex carbs, here you have, again, some examples of how you can have a fourth of your plate be, one of these or two of these things. And so sweet potatoes are a favorite for me. So if you like steak and potatoes, and you don't really add a lot of greenery or vegetables or things to it, you could add broccoli or a salad to make it even healthier. And instead of the white potato, you could add in a baked sweet potato without any of the extra things like cinnamon, sugar, and what have you that we sometimes add. You could just add some healthy butter, which is a good source of fat. And then that's a great way for you to have a steak dinner and make it a healthier version. And then kind of say no to the rolls and the appetizers or desserts that you might get after, and maybe have a healthy dessert that you have at home once you know that you are actually wanting a dessert and that you're not, already full from what you've had at dinner. And that's a great way for you to make a typical dinner meal that you might have on a weekend be healthier. You also have some starchy and non-starchy vegetables that you can choose from. We would always recommend non-starchy first, and we want those to be about half of your plate. And so here are some examples here. I love okra. Just remember, when we think about the vegetables, these are non-fried versions. And so, you can saute okra. I've had okra prepared 3 different ways this week. It's one of my favorite vegetables. And actually sauteing the okra and putting some olive oil or EVOO, extra virgin olive oil, with some pepper flakes is a great way for you to eat okra with not having it be battered and fried. So these are some examples here. Healthy fats, of course, I'm always going to say avocados and cheese because those are my favorites, but dark chocolate, the whole egg, so not just eating components of the egg. You really need to eat eggs in their entirety. So don't just eat, the yolk or the albumin white shell part of it. Eat the whole egg. Try to make sure that these things are organic and farm fresh, that you're not having a lot of chemicals or additives, nuts and seeds and things like that. These are all great choices. Diet and exercise, we want to make sure that for our cardiovascular health that we're really meeting our goal of reducing our body weight by 10%, and having that 10% reduction in body weight will be really helpful to you, and you'll see a lot of improvements in your overall health. It also will help alleviate the pressure on your joints, which can cause a lot of pain and discomfort. And so we know that having at least 30 minutes of exercise 4 to 5 times a week is where we want you to be once you've worked up your, to that level of exercise. But just start out with a 5 or 10 or 15-minute walk after dinner, and build up your stamina. So again, there's lots of medication treatments that you can, use in conjunction with healthy lifestyles to be able to manage your diabetes. And we want to make sure that you do that in, the supervision and care of your provider. And so definitely reach out to them if you're wanting to make a change. And then, of course, stress management. We want to make sure it's positive coping, like I mentioned. Check in daily with how your stress is doing. It's going to fluctuate, and just know that you may have a great minute, a great hour, a great day, and then tomorrow you may feel like it's kind of unraveling. And in the context of a pandemic, that's really to be expected. And just know that we're all in this together, and we're all experiencing new things. And so don't be afraid to share your struggles or challenges, and don't be afraid to reach out for help if you need it. Extra support is always helpful. And then, of course, movement, meditation, unplugging, disconnecting, resting, those are all great ways to really reduce your stress. Stress management can really become about, bath bombs and chocolates and really indulgent things, but really it's much more simpler, than that. It's much more about meeting your needs every day than about doing expensive self-care things. And of course, we've mentioned monitoring your blood sugar and how important that is, and make sure that you use the guidelines given to you by your provider. But you want to make sure that you know what your blood sugars are fasting and non-fasting, and then, to spot check them throughout the day, even if you've been really good with your maintenance and your numbers look good. And then, of course, there are going to be other times that you need to test based on whether you have type 1 or type 2. And so, again, provide information to your provider so that they can give you good feedback and tell you what to do. But you are going to probably need to test more if you are with a type 1 diabetes diagnosis, because of the increased risk factors for not having that insulin on board that can help with the blood sugar levels. And then something that I would like to recommend, a book that has a more natural approach to diabetes management, is Master Your Diabetes. And it's a comprehensive integrative approach to, actually managing your diabetes well. And this is written by a naturopathic practitioner, so not an MD. And so you'd always want to take any suggestions that you see here in the recommended reading or in this presentation to your provider for their feedback and expertise, because they know your history and your medications and your other complications or diagnoses better than anyone other than you. You know yourself the best, but they need to be able to give you that good feedback and guidance on what's best for your care plan. But I think this is just great for educational purposes, so that you feel really equipped and empowered to start to make healthy lifestyle changes for yourself. So I hope this was a helpful webinar for y'all. I know we're going to be at our time, but I'm going to stay on to answer questions. And so upcoming classes, we have several coming up in September. The next one that I'll be teaching is Cultivating Healthy Habits. And so if you're wanting to learn more about how to do some of the lifestyle modifications that I mentioned here, you may want to join us for the Cultivating Healthy Habits. It's 1 p.m., same setup as we had today on September the 2nd. And then you can always go back and watch the archived webinar as well if you want to get some tips and some extra resources. We also want you to follow us on social media. We have a website and Facebook and Instagram and a blog, and I write a blog post for every webinar that I teach. And so all of that information is here for you. And Ashley, who's on the call, does a phenomenal job of managing our social media for us. And so all of that is great tips and tools and resources for you to check out. And then just in closing, we want to make sure that we answer any questions that you might have. And we also want to make sure that you know about our health and lifestyle coaching that you can get through the Office of Wellness and Work Life. And I offer those sessions. And so if you have questions about that, please feel free to email me and we'll be happy to answer your questions or get you set up for an opening session for coaching. So do y'all have any questions for me before we close out today? All right, you're welcome to put them in the chat, unmute, or put them in the Q&A. Thank you. I appreciate that. I'm glad this was helpful. Are there any questions that I can answer? Give just another minute to make sure I don't miss anyone's questions. Thank you. I'm glad it was helpful. Thanks, Jennifer. Thanks, Danetta. Thank y'all. Y'all are very sweet. We love to hear feedback. So if there are other things that you think would be helpful for us to cover around this topic or other topics, we're always happy to hear that feedback, because we want to make this something that's really helpful for all of you and that supports your learning goals and needs. All right, any other comments or questions? Thank you, Holly. Hope you have a good day too. All right, well, we'll close out. I know this is the beginning of the fall semester and y'all are really busy, so thank you for all you do. Again, thank you for being here and for taking time for your health and well-being, and we'll end with the big roll tide, y'all. Have a great one.